Hey guys, this is a 6 o'clock class. I'm just here a little bit early. That's all. I haven't started yet. It's about 5:55. Um, I'm just kind of writing down some notes, getting ready for you guys. So those of you who are have come in early or who are going to archive this, make sure you get those books down. Okay, we finished oncology yesterday. Oncology was pretty long. You guys know oncology was like horribly long, but it was very interesting. Okay, so today we are diving into radiology. Okay, um, radiology and nuclear medicine, and we got a little taste of some of the nuclear medicine yesterday. Okay, so also you guys see that thumbnail I put out there about the Twitch thing, right? Those of you who do have Twitch, if you don't, everybody should have Twitch. Everybody should have all social media, especially if you're doing the business. You guys subscribe to my channel on Twitch. I'm building that kind of slowly, but eventually I'm going to have subscriptions, and there will be subscriptions for the class. So I may go ahead and stream on that as far as live classes. Now those chats will not be recorded. They will just be chats for you to interlock with me, and we'll have chats like what we're doing right now. They're just not recorded. Your recorded chats will be here on YouTube. I started to do the Zoom chats again because those are the longer chats for the Sapphire people. But Sapphire people, I still want you in the YouTube, okay? That's where you're going to have your courses at. Some of you who are starting now, open enrollment is every day. You get in on the YouTube. If you're coming in now, that's fine. You can get in on these chats right here, or you can archive these chats. Um, because we're going to eventually backtrack. It's going to be repetitious, and we'll be doing medical terminology again. Okay. The longer courses, the longer chats are going to be on the Zoom, and those are locked. Those are in the Sapphire. Those are in the Sapphire portal. We'll do a one-on-one, and I'll show you how to get those. In the Sapphire portal, if you can't find something, let me know. Okay, we'll do another one-on-one so I can walk you through that portal. Okay, we haven't started yet. We still got a few minutes before I actually start the class. So you guys don't forget to go on Sapphire Coded and check out those courses. So that's why a lot of people have been telling me about the Twitch, which I know several people who actually do Twitch. They're not, like my age. They're a lot younger than me that I know. Um, that we're just kind of taking heat from, and I think it'd be fun. We were on this morning, trying to get the audio right. That's my website. You guys go ahead and check it out. I don't know why the links are not up here. So the links for the Kindle. Remember the Kindle. Those books that you guys need that are in the Kindle. Those links should be below this course. I usually put all the links below anyway. Also, if you guys want to donate to Sapphire Physician Coding, do not hesitate. There's a link up there, pay.sapphirecoding.com. Even if you donate $1 or $2, it goes very far within Sapphire Coding, okay? So you guys go ahead and do that. And I'm just trying to get your ISBN out of there so I can put those links up there. And do not forget, if you guys, I don't want that one. If you guys want to join the class, do not hesitate, okay? Oh my goodness, I don't know why that's there. You know, when you're doing something and your system says, it says delete. Oh no, don't delete anything because I don't know what it is. So we are deleting. Okay. This email, you can email me from here. So I am dropping notes on the side for you to email me. Okay. You can use that email or this one. So today, this will be a kind of long chat. We're gonna do a little chit chat too. I was out today. I went to see a softball game. I didn't get pictures. I don't know what happened. I didn't get pictures. The babies were like 2 and 3 and 4 years old, and they were having a little softball game. It was the cutest thing in the world. I'm telling you. And I was so excited and involved with them. I forgot to take pictures. Y'all know I always take pictures and put them on. Uh, but that was my day. So okay, so let's get back to this. Let me get your links up there. All right, so here's your ICD-10 link. Now, in your ICD-10 link, uh, you will have access to the coding guidelines. Make sure you get them down. I was watching one of my other co-YT teachers, and it was so informational. It was only one thing. Students were having issues getting books. Um, Kindle has like the what do you call it? Like a sample type of version. And most books do. Most books have like a sample type of version. And this is what I'm really giving you, you know, but there's a lot of pages in this. Okay, so that's why when we get ready to start, I gotta put the other one up there. We get ready to start, you guys can use this. And I've used it before, so it's fine. Um, and we'll do that um, because some of you don't have your books. Okay, so when you guys are actually archiving, okay. So I'm gonna go ahead and share my screen. So we are in class 19. I know we are in class 19 already. Um, Class 19 consists of nuclear medicine. Okay, I'm gonna put this up real quick. Okay, we are in chapter 20, class 19. Okay, we almost had it combining together. We almost had 2020. We almost. Okay, and we probably do. I gotta check the numbers because it should be 2020, but it's okay. So we are on chapter 20, radiology, and of course I got the air on. I turn it on, I got to turn it on, turn it on, turn it on. Okay, so we're in radiology, okay, nuclear medicine. And we actually did some of this in the last class. So we did some of this in the last class, which is fine. Um, you guys make sure you have taken notes on that oncology class, okay? So again, this is going to be our 20th chapter, okay? List the physical properties of x-rays. We are in chapter goals. Identify diagnostic techniques, radiologists, nuclear physicians. You guys seen all of this already. Okay, diagnosis diseases, recognize medical terms and specialty radiology. So this is actually, can you guys see that picture? This is going to be very similar to what we did yesterday because oncology consists of a lot of radiation and stuff like that. So a lot of that is going to be actually in here. So I don't think this is going to be long, a long chapter. I think it'll be okay and you guys can pretty much get through it. Okay. Okay, so it is the same what you guys will be doing. You will have an introduction. We'll talk about the radiology, introduction to radiology, nuclear medicine, and vocabulary. You see, it's not going to be a long chapter. Okay, so I'm going to be right here. Those of you who have your books, just kind of follow along. Make sure that you have your index cards to take some of these words down. Introduction, radiology is the medical specialty concerned with the study and application of x-rays. Okay, let me make sure this is not screaming. Okay, and application of x-rays and other technologies. We're talking about ultrasounds and magnetic resonance. Now, listen, there's going to be a lot of abbreviations here. This is what you need to know. There's going to be a lot of abbreviations here. So, as we are studying and getting to know medical terminology, just make sure that you write down what you need to. Okay, and of course, I'm going to give you things that I think is going to be on your test. Okay. All right, so magnetic resonance. Okay, to produce and interpret images of the human body for diagnosis of disease, x-rays are invisible waves of energy that are produced by an energy source, like x-rays and stuff like that, okay? And are useful in diagnosis and treatment of disease. Yeah, because we just read some of that. So that first part, the first part that's in that introduction that actually tells you what radiology is. Yes, you need to remember that. So, in your study, make sure you put that on an index card because, it's a part of you knowing radiology. It's a part of you knowing radiology, okay? So that small introduction, it's a lot more, but you guys go ahead and read the rest. I'm on page 794. The main thing is what I just told you. Radiology is the medical specialty concerned with the study and application of x-rays and other technologies. Okay, finish reading that. We just read that. Okay, nuclear medicine. So remember, this chapter is nuclear medicine and radiology. Now, when you guys start doing the coding for this, just kind of be careful when you're doing the coding for this because a lot of those codes look the same. A lot of those codes look the same. You remember what we're going to do? Highlight the code that's a number off from the other one so that you can decipher those codes. Okay? I didn't put nuclear medicine down here. I got to put it in. Okay, nuclear medicine, okay, is a medical specialty that uses radioactive substances in the diagnosis and treatment of disease. These radioactive substances are materials that emit high-speed particles and energy-containing rays from the interior of their matter. Now, what radiology is and what nuclear medicine is, yes, make sure you retain that. In my Q&A book, in all of my books, you hear me, I repeat things explicit because these are the things that may be on your exam, okay? If you want more in depth of the classroom, you have to go to the website and sign up for the program. Okay, you have to sign up for the program. I'm going to start putting the Zooms in there. So anybody who's not able to get in on the live chat, you can always even archive the Zoom. The Zoom is going to be in the Sapphire portal. Okay, the Zoom is going to be the Sapphire portal. So as soon as I get those dates ready, we're going to figure that one out. And more than likely, it will be the next session, the next class is not the coding class. The next class that comes about from the medical terminology and the medical billing. When we get ready to do that coding class, YTU and Sapphire, you still will have classes here, but your longer classes, Sapphire, I'm going to put them in the portal. Okay, so what we do here is minimal than what we do in the Sapphire portal. The Sapphire portal classes will be much longer. You can, when you get in the portal, you can go ahead and archive that. You can look at that as many times as you want to. Okay, the main thing is I want to make sure is that you guys have your books by the time we get to the coding. Okay, the links are on the side. Just make sure you got those links. Okay, so again, I'm on page 794. If you have a different book, you may be on a different page. Okay, we are talking about nuclear medicine now. Just a brief description telling us what it is. Okay. Um, Gamma rays, I want you guys to look up gamma rays. Gamma rays are used effectively as a diagnostic label to trace the path and uptake of chemical substances in the body. Get that down, okay? A nuclear medicine physician specializes in diagnostic and radionuclide scanning procedures. So again, if some of you are going to work for radiology, like I told you before, one of my girlfriends actually works in radiology, okay? And she had nothing. She didn't know nothing about radiology. She was a CNA. I mean, she didn't know nothing about radiology. Once you pass your certification, if that's where you're going, go ahead. And if you don't have to just take radiology, when your CPC is everything in there, she felt that's where she was best. Okay, so all of you who will join the class and all of you who are new to coding, this is a beginner class for you. We are going to start from the beginning. Um, as we go into the coding, you will get into the more advanced classes. So you see how I am literally going through page by page. So it will be, if you guys know how many books we have left. Um, I'm just going to pull this up real quick. We have already went through two classes. So in regard to the two classes that we've already gone through, if we say ICD-10 CPT, which is next, okay, and your HCPCS, which is next. But we have already gone through the medical billing, right? That's going to be next, and this is your language of medicine. So if you join the Sapphire Academy, this book comes with your course, and the program is still $59.99. Just go on my website, look on the side. Now, the step by step, and this is how we do it. This is how I do it at Sapphire. Step by step. You've never done billing. You've never done coding before. We are going to take you step by step. We are in class 19. We have a few classes left. We are almost done. Okay. You need to have the step by step book when we start that class. Okay. I think the Kindle also has this one. I didn't check to see that, but I believe it does. Okay. What is this? I'll tell you, I have so much stuff up here. I don't know what it is. So when you guys go into your Kindle, you can just merely type in the step by step, and you'll come up with that one as well. I'm going to find that one for you and also put that one in here. We're going to have like a small break because I've got another class coming up, I believe, at 8 o'clock. I have another class coming up at 8 o'clock, I think, right after this one. But you're going to need this, okay? You're going to need this. If you don't have it, you guys can follow along with me. Okay, just follow along with me. But the Kindle does have it. I have to get you the link for it, okay? Um, okay, so nuclear medicine. Okay, so make sure you get that down. Okay, radiology, characteristics of x-rays. The purpose of you reading this portion is to give you influence on nuclear medicine and radiology. You will have more training on radiology and nuclear medicine. This will not be the only thing that you will be trained on in regards to these two subjects, okay? You have this also in your step-by-step. You have this also in your CPT. You will have this also in your CPC guide, okay? So your advanced courses, once you master your step-by-step, once we get through with how to do this, how to do that, how do I code, Once you understand the concepts of the coding and how to put those codes together, then we're moving on to the advanced coding portion. And during this portion, you guys are going to need your CPC guide. Okay, but that's going to be down the line. Okay, I'd like to put that book up there, but that's going to be down the line. Okay, we've got to do it step by step, and then we're going to the CPC guide. We're going to make sure that you pass that exam. Okay. Okay, so characteristics of X-rays. I'm on page 794. Ability to cause exposure of a photographic plate. Okay, if a photographic plate or other detector is placed in front of a beam of X-ray, the X-ray travels unimpeded through the air. Okay, I mean, it's amazing. It's like if you didn't read this stuff, you would have no idea how this stuff works. You just go to the doctor and they just do it. Okay, just hit a button, they do it. Imagine 10 years from now. I can't imagine what they would come up with. Okay, so invisibility, X-rays cannot be detected by sight. We know that. Hearing or touch. Okay, workers exposed to X-rays must wear a film badge to detect and record the amount of radiation. They probably get tested every day before they go home. I'm pretty sure they do. You guys know they put the magnet, the shield over us before we go in. I've had so many X-rays. I've had X-rays since I was 10 years old. I used to get those migraines and, those throbbing migraines. They probably started, I was like 10 or 11 years old. And I mean, it's like no cause. It's like, why do you get this? Why, And I had every X-ray in the world. I had every trauma in the world, and they just cannot find out why I had them. After I had my son, I was 26 years old, and I had my last migraine when he was about 5 years old. It was the worst thing in the world. And all I can say is, when is it going to end? Why do I still get these headaches like this? That was the last migraine I got. My son was about 5 years old. My son is now, I don't know, 32. And I haven't had a migraine since. So, I mean, they did every radiological thing that they can think of to find out why. And there was none. There was none. Okay, so I am on 795. And again, you guys are going to just make sure you read this section. The other day we finished with oncology. Oncology was pretty long, but you should be finished with that. Your exercises should be done. Everything should be finished. If you have ordered the medical terminology book with the quiz in there, then you should be ready to go ahead and take the quiz. Okay. So every chapter has a quiz, right? Every chapter has a quiz. Good. Those of you who are in the Sapphire Academy, your quiz are in the portal. Okay? Your quiz are in the portal. If you didn't get your email to have access to the portal, let me know. X-ray studies, diagnostic techniques, digital radiography. X-ray imaging is used in a variety of ways that detects pathologic conditions. Digital radiography is a form of X-ray imaging, which digital X-ray detectors are. Now, you guys, you won't see any of this stuff, but you do have to code it. You do have to code it because these are services that the patient is getting from the hospital. You still have to bill it. Okay. Well, you have to code it. The billers have to bill it. Okay. The chest X-ray is the most common performed diagnostic X-ray. Yes, you have chest pain, they will do that first. Another common use of the X-ray is a dental practice located cavities in the teeth. Mammography uses a low dose of X-ray. Okay, so we know that. We are pretty familiar with that. Everybody, I won't say everybody, but those of you who are at the age to have your mammograms, you're pretty familiar with that. Okay. This CT computed tomography, we saw some of that in the cancer section, right? We saw some of that in oncology. The CT scan, remember that should be on your index card. The CT scan, sometimes called a CAT scan, because the technique originally was known as computerized axle. tomography. I remember back in the days when it was called that. It's made by beaming X-rays at multiple angles through sections of a patient's body. Yeah, yeah, yeah. Anybody have had anything more invasive? Like, you guys remember when you even got an X-ray when they used to use the plates and put them under your leg and then take the X-ray? I don't think they do that anymore. I think they're so advanced now. They don't do that anymore. They take the plate and put it under your arm, and then you got to do the X-ray. I don't think they do that anymore. Okay, so make sure you get that down, the CT scan, okay? A CT scan is sometimes called a CAT scan, computed tomography, okay? No, we won't use that. This one as well, in radiographic contrast studies, that's one. I had contrast before too. One time, my friend was moving and we were just nonstop 3-4 days straight, back and forth, back and forth. And I think I just literally passed out, and this is what they gave me. In radiography, the natural differences in the density of body tissue from air and lung or from calcium and bone produce contrasting shadows on the radiographic image. However, when X-rays pass through to adjacent means connecting body parts composed of substance of the same density. They do this when you can't see stuff with an X-ray. They give you the contrast. Sometimes it's blue. Okay. Where am I? Composed of substances of the same density. Their shadows cannot be distinguished from one another on the film or on the screen. It's necessary then to place the contrast medium into the structure. Well, every time I look at stuff like this, it always gives me flashbacks on when I worked in a hospital, and then it makes me want to go back to the OR. I did think about doing the OR a couple of months ago. One of my girlfriends kept talking about it, and she did eventually go back. She worked with the feds, but she did eventually go back and do the OR. And I mean, like, I said, girl, I'm too old to go. I'm not going back to no school to do no tech in the OR. And she said, yes, you are. If it's online, I probably would. But when you see stuff like this, it like gives you back flashes about when you're working in a hospital, when you see all this stuff. Because up in revenue cycle, we don't see none of this. We don't see none of this. In revenue cycle, we are either in the offsite, or we are either in like a faculty practice, or we are either in a business office. We are not directly in the hospital. So any of you working in revenue cycle, you will not be in the hospital. The billers are in the offset. The codings are home. So we're talking about the billers. We're talking about the billing cycle, the front end, the check-in person, registration. Okay, the billers are there because they got to check the claims. They got to run the claims and stuff. And it's not like those of you who are doing your own business. It's not impossible for you to even do the billing at home. I gotta get the girl's name on my Twitter. She's a doll. And she has the machine at home to drop a claim. She has a machine at home to drop a claim. But technically, when you drop claims, they don't need to be printed. Many years ago, we used to have to print out Medicaid one by one. And fold the claim up. Put the claim in there and mail the claim out. I know. I'm talking here. I can't even remember back when about 20 something years ago. That's the way we used to do it. About 20 something years ago. I think I was in anesthesia back then. I think I worked in every single specialty I can think of. But that's the way we used to. Was the way we used to do it back in the days. Okay, so CT scanner, guys. Make sure you guys remember that. All right. CT scanner, and make sure you remember contrast medium. Okay, so let me move down. Y'all know I'll get lost. Well, they're showing you the body. I don't know if I can show this picture. All right, so I'm not going to show that picture. Let's find something else. They're just basically showing you X-rays. I think I can show you this one. All right, so let me show you this picture right here. I'm just kind of scrolling through. Some of these pictures is kind of basic, so I can't really put them on. But this is where I'm at right now, and these are the type of things I want you to study. This is during the X-ray. They're kind of telling you what they're X-raying. Okay, this right here: gallbladder, pancreas, vena cava, right kidney, spinal cord, aorta. It's not a picture where you can actually identify something in there. That's why I really didn't want to give it to you, because you can't really identify anything that's in it. But when you get to this page, the main thing I want you to do is do the reading and just try to take heed to some of these illustrations. Because in your CPT book and your coding book, you're going to have illustrations anyway. CT scan through various regions of the body. The level of the scan is indicated on the figure of the body. This is what they're talking about, what we just looked at. But that's ebonics to us. That's not going to help us on the test. Okay, barium sulfate. Barium sulfate is a radiopaque substance that is mixed in water and used for examination of the upper and lower GI gastrointestinal tract. Okay, upper GI is UGI. Yes, we need to get that. Okay, we need to get that. Involve oral ingestion of barium sulfate. Is that your orange stuff, y'all? So that the esophagus, stomach, and duodenum can be visualized before you go in it. A small bowel follow-up through. Okay, so take this one down. I don't think this is going to be on there, but get it anyway. Small bowel follow-up through, SBFT. Barium enema, BE. I'm pretty sure people have had that. Okay, y'all can go ahead and read it. I'm not going to read that part. So I'm going to introduce you to the double contrast study. Yes, read that portion. Because that sounds like something that might be on your test. For example, the wall of the stomach or the intestine. Yes, read that portion. A double contrast study uses both a radiopaque and a radiolucent contrast medium. Both. Okay, in these questions, I'm thinking we're only on the AAPC. These are called the open and closed questions. They may say, what is barium? They may say, what does UGI mean? And you'll have 4 multiple questions. Okay. But again, you're only going to have, 5 questions on medical terminology. The important part is to make sure that you understand the cases. Okay. You're going to have 10 cases. It is my opinion to do the open and close first. Okay, not the cases. Do the open and close first. And then you do the cases. You need as much time as possible, okay? You might not need a full 2 minutes on the open and close. Study as much as you can. Read your medicine chapter many times. Your medicine chapter should be, is that the back of your CPT book? It should be, that should be the last chapter in your CPT book, okay? That's the last chapter in your CPT book, which is what we were going to start with, but we're going to start with the first 2, the E&M, and we're going to start with E&M and anesthesia and integumentary and muscle, because that's what's in that free Kindle until you guys actually get your book, okay? Okay, so angiography, make sure you get that down. Okay, X-ray image of blood vessels and heart chambers is obtained after contrast is injected through a catheter. Okay, in the appropriate blood vessel. So this is just to be vocabulary. This is just to be definitions. And yes, this is most important. Okay, cholangiography, yes, X-ray image after injection of contrast into bile ducts. Let me do the first one again. Angiography, X-ray image of blood vessels and heart chambers is obtained after contrast is injected through a catheter. This is in case y'all want to get this down, into the appropriate blood vessel or heart chamber. How many chambers is it? It's 4 chambers. Remember, we just did the heart, y'all. But don't worry about it. Y'all can always go back and archive. And remember, after we finish coding, it's repetitious. I'm going to start all over again. Okay? You may get more, you might get less, you might get more and more and more. So I'm pretty sure these Zooms, I can't put the Zooms on here, but if you guys want to get more in depth, with the classes, you have to join the program. Especially, I recommend the program is only $59.99 right now because I still have a couple of those grants. Um, 13, 14, no, the 15th. So I'm looking for the grants on the 15th. Um, so right now it's still the same, but I will have to bring it up, okay? As long as I get that class full, we good. And don't forget to do the Twitch. Y'all gonna have subscriptions on the Twitch, okay? So again, just make sure you go into that sapphirecoding.com and check out those classes. Okay, it's not just classes. You guys, that's how you get access to the portal. So um, make sure you take heed to angiography and cholangiography. Okay, cholangiography, X-ray image of after injection of contrast into the bile duct. Okay, coronary angiography. You guys seen this before? Some of you have already went to school for coding or billing. When you go to school for coding or billing, um, you have to have medical terminology. So some of you who are already there, I know you guys have seen some of this before your medical terminology class, because she pretty much does the same thing. She does the same, or he, your instructor would do the same thing. They have to go over certain points. Whether it's on a CPC or not, it's in their accreditation, it's in their scroll book. They have to go over certain things, okay? And every single page that we go over, they got to go over the same thing. So, you see how it's the same. My course and a course that you would normally take in a sit-down traditional college, it's the same thing. Technically, pharmacology and the customer service, no, I mean, the pharmacology we're going to do because it's in this book, but it's not mandatory something for you to do when you take in your AAPC. Okay, depending on what CPC you take. Okay, so I'm on 798 myelography, X-ray image of the spinal cord, hysterosalpingography, X-ray of the endometrial cavity, salpingo. Salpingo, what is that, y'all? Salpingo. Did we do female? Yes, we did. Histo, what does it sound like? Hystro, HYSTR. Let me show you what I'm looking at. Salpingo. I can't wait till we get to that part in the coding. Histo as in hysterectomy, salpingo as in uterus, X-ray record of the endometrial cavity and the fallopian tubes is obtained after injection of contrast material. Digital subtraction angiography. You can put that, the abbreviation will be GSA. The myelography we just did. Make sure you guys get that down, okay? Percutaneous transeptic of the cholangiography. Yeah, that's disgusting. I mean, it's not disgusting. It's what they do. You have to have these things done in order for you to get better. Pylography. So all of these words that I am giving you are imperative for you to retain. Okay, X-ray image of the renal, pelvic, and urinary tract. Okay, I'm on page 799. I'm not going to go in depth with it that much. I want you to go in depth with it. I'm going to do the Zoom on this more than likely. I'm going to start that next week. The Zooms they're much longer, more like like a traditional class. These classes we have to keep them at least an hour. I don't want to have, because you guys have an hour after this that you have to study. So I don't want to have you in this class longer than you need to. Okay. Digital imaging techniques. Make sure you get that down. Can be used to enhance conventional and fluoroscopic X-rays. Now, if you don't have your book and some of these words you hear me saying, type them in. Type them in your search engine, and you will get the definition of them. You will get the meaning of them, and sometimes it gives you an example, like, because that's what this book is doing. It's giving you definition and it's giving you an example of the key performances of the word. Okay. Interventional radiology. I mean, there is a lot in here. Radio frequency ablation. Make sure you get that one. This one is a total must. Fluoroscopy is the use of X-rays and a fluorescent screen to produce real-time video images. Make sure you get that because providers do a lot of surgeries with fluoroscopy, and there are a lot of codes where the fluoroscopy is already added, and then there are codes where you have to add the fluoroscopy code. Okay, so take heed to that word. And sometimes the providers forget to put it in. Okay, ultrasound images, ultrasound imaging. Okay, get that ultrasonography. You guys know what that is. We've seen that plenty of times. Okay. Um, the sonogram, the record produced by ultrasound imaging is called sonogram. You got to do echocardiography. Okay, cardiologist uses ultrasound techniques to detect the heart and blood vessel disorders. Echocardiogram. That one is actually a no-brainer. If you see that one and you know it says echocardio, you know it has to do with the heart because you see the cardio right in there. Do not forget this tip for your CPC. The answer is always in the question. The answer is always in the question. Okay? So you get that test, don't you freeze up. Obstetricians and gynecologists use ultrasound imaging to differentiate single from multiple pregnancies, as well as to help in performance amniocentesis. Anybody ever have amniocentesis? I don't know anybody who actually had one. I mean, I've seen them before. And gastroenterologists use it to locate abdominal masses. That's echocardiogram, abdominal masses. Obstetricians and gynecologists use the ultrasound imaging to differentiate single from multiple pregnancies, as well as to help in performance of amniocentesis. Other uses are to image benign and malignant tumors. So is anybody here wanting to work in radiology? Have anybody want to work for radiology? Let me know how it is in your office. Are you in the office or you're in a hospital? Radiology, I don't know. I would always be like, I don't know how to do radiology. I'm scared to do radiology. I am not going into radiology. But you'd be surprised. The strongest person will go in there and hit that radiology. If you're coding for one specialty, you got it, man. If you're coding for multiple specialties, like a hospital, of course they're going to pay you more. Of course they're giving you sign-on bonuses because you coding for everybody. You're not just coding for one specialty. When you work for a doctor's office, yeah, you might code for a couple of different things, but more than likely, if you go work for a cardiologist, that's all you're going to do. You'd be very easy to master that particular coding. Okay. I can show you this because it's pretty much, they're just kind of showing you where the amniocentesis needle is going. Some of you pretty much may have had one before, but that's it right there. It was a cartoon, so it's not nothing that's too, fetal measurements taken with ultrasound imaging. We know that. I had a fetal picture somebody gave me. I wish I had kept it. Fetal ultrasound scan. She lost her baby. That's why we didn't keep it. Okay. I hope she still has it. Fetal ultrasound scan at 13 weeks. And again, ultrasound can tell you, how far along you are in your pregnancy. They can even tell them when the baby's due. Okay. If you're not sure, trust me, they'll figure it out. Ultrasound imaging. Okay, advantages. Okay, this one. Make sure you get this down. Doppler ultrasound. Okay, Doppler ultrasound. Two ultrasound techniques: Doppler ultrasound and color flow image. Color flow image. Color flow image. They put the dye in. Make it possible to record blood flow. Okay, and they can also, when they do that, they can also see how fast the blood is going through your veins. They can see how fast your blood is going through. Okay, is it because it's a cycle? Okay, two ultrasound techniques. These techniques are used to image major blood vessels. They can see if you have small or large veins. You know, when somebody got to get a needle done and they can't get blood taken, they can't get blood because the veins are so tiny. Um, my grandson is like that. His veins are very, very tiny, but his mother is like that, very, very, very tiny. My little one he's more like me, and my sons are just huge. It's hit the right one every time. Okay, so make sure you get down Doppler ultrasound and color flow imaging. Okay, right now I'm on page 802. So on page 802, how am I on page 802 and I'm not, well, I'm on page 802, but I'm just looking because I'm seeing nuclear medicine. We're on 804. Okay, so we're getting ready to come into the vocabulary. So it looks like they had a lot more nuclear medicine than they did on regular x-rays. Okay, so magnetic resonance, yes. MRI, yes. Magnetic resonance imaging, make sure you get that down. Make sure you get down endoscopic ultrasonography, get that down. Okay, ultrasonography is used in interventional radiology. Okay, to guide needle biopsy for the puncture of a cyst. You can read the rest of that. And endoscopic ultrasound radiography, a small ultrasound transducer is attached to the tip of an endoscope. We can't see any of these tissues. They're not giving us pictures of that, but you guys put that in the search engine so you can see what it looks like. Okay, so magnetic resonance imaging, MRI. Make sure you get that down. That sounds like test to me. Okay, uses magnetic fields and radio waves. Now, this is what they're going to ask you. You need to know the differences between the MRIs, MRs, the CT CAT scans, the ultrasounds, the sonographies. They're going to ask you the definition of those. So if you say magnetic resonance uses magnetic fields and radio waves rather than X-rays. This is a CPC question. What uses magnetic fields and radio waves? What are you going to say? I didn't do that, but just flip that around. MRI. You see how I said the question is in the answer. The CPC is not hard. The hard part of the CPT is to study for it. It's to study for it and to actually sit down and take it. You're not going to be able to if you're not going to study for it. I don't care if you look at 55 channels on YTU. Get something from them where you're not paying $27,000 about no car. Okay, what was that? Yeah, it's time for a new ponytail. Okay. So study as much as you can. Set those 2 hours aside. You must study for it. I will be in, I'm going to be in the portal. I think that next class for you guys is at 8 o'clock. What is it? Let me see what that class is. What is that class? What are we talking about? Because I set 2 classes for y'all today, right? Oh, no, I didn't. Oh, okay. Oh, I thought I had 2 classes for y'all. So to Twitch. Okay, hold on. I did. I thought I had 2 classes for y'all. Hold on. I can see what happened in there, but don't worry about it. I'm going to flip that and we're going to fix that right. There's another class tonight, and that class is going to be on the Twitch class. It's going to be on the Twitch class. So when this class is finished, it's going to be on a Twitch class. This class is your radiology and nuclear medicine class. And the other class is I'm going to flip that. I'm going to flip that cover right out of there. Okay. So don't worry about that. We're going to flip that right out of there. So again, this is your 19th class for us to do. Okay. And one of the things that we talked about that we're going to do on that other one is what, y'all? Subscription. We're going to make a way for y'all to have that subscription, okay? The subscription is going to make you guys be able to go to the class. That's what it's going to do. It's going to make you guys be able to go to the class. Okay, hold on. So this is the one that you guys were supposed to do. The other one, but it doesn't matter. I'm just going to flip those two things, and you guys are going to archive this, and then I'm going to jump into that. So again, let's just go ahead and finish with this, and then I'm going to flip that, and then you guys can archive that. Okay. So it looks like that one wasn't done, but we're going to go ahead and we're going to change that. I'm not going to move it because I'm going to mess around and lose my log. Okay, so right now we're actually almost finished with this. Here we are down to the differences between CAT scan and MRI. Okay, the differences between CAT scan and MRI. Okay, so they're showing CT, CAT scan, your bones, chest, and pneumonia. Okay, they're trying to see if you have pneumonia. Okay, they can check for bleeding as well with the CT. And MRI, they can check for spinal cord and brain injuries, tendons, masses. They can check for neck lesions for MRIs. And again, it's just giving you familiarity with the MRIs. Okay. Magnetic resonance, and this is what this is looking like on magnetic resonance. Okay, so some of you might have had this before. You probably could see this if you've had something like that before, but I like the pictures that they have in here. They're pretty good. And here's a good explanation of this right here. Those of you who do have your books, check that out. And you can take it right from here. You can see x-rays, contrast studies, you got your ultrasound, you got your magnetic resonance, radio waves. That's what you're looking for. Those are the things that you're looking for. So in your CPC guide, it's going to tell you the same thing. Your posterior, anterior, posterior. They're showing you how they're taking these x-rays, oblique x-rays. I don't think they still do them exactly like this now. Those officers that actually have money, they're the ones who do this. So I've got to change that. I've got to change. I went into the wrong chat. I went into the chat that was supposed to be 8 o'clock. I was supposed to go into the chat that says radiology. So that we're going to change, and then I'm going to have to flip that around. Okay. So it looks like we're not in that chat, but we're in that chat. But I can't change it. Okay, I'm going to see how I can. Okay, so we're not going to mess with it. I'll do it after this because I know you guys are coming into the chat and we're talking about the Twitch. We're not talking about the Twitch right now. Okay, we're talking about nuclear medicine. Okay, that's what we're talking about. And I have to flip those charts on there. What do you call them? Chat pictures. Okay, so this is going to give you a description. And yes, I want you to get to know this. The posterior anterior is the most common requested chest x-ray. Okay, this is it right here. That's the first one, the posterior anterior right here. Okay, these are like the most common that you're going to see. The most common that you're going to see. Abduction, decubitus, eversion, extension. Yes, I'm on page 804. I want you to look at that. Okay, so nuclear medicine, the spontaneous emission of energy in the form of particles or rays coming from the interior of a substance is called radioactivity. Get that down, okay? Radionuclide, we talked about that. It's a substance that gives off high energy, okay? I'm looking for other words that may be on your test. I'm on page 804. You're going to read this word for word. Okay. In vivo tests trace the amounts of radioactive substance within the body. In vivo. Make sure you get that down. nuclear medicine tests, in the vitro and in vivo procedures. Nuclear medicine physicians use two types of tests in the diagnosis of disease: in vitro, in the test tube procedures, and in vivo, in the body. I can't stress enough how important that is for you to get down. So I know you guys are coming into the chat thinking it's the chat about the Twitch, and it's actually your class chat. I'm going to flip that, and you guys go ahead and come into the chat, okay? So let's go down. We can get to bone scans. We did those already. I mean, it's pretty much an X-ray scan or bone scan machine. A patient receiving intravenous injection of radionuclide for detection of heart function. So we've done that before. I know several people have had that. Position emission tomography, that's PET, or PET PET scan. Take that down. That sounds like testing me, y'all. And we talked about some of that actually in oncology. We talked about that actually in oncology, okay? Let me just put this here. So I'm going to switch that to where it's supposed to be, because I know a lot of you supposed to have been in this class, and I think that's why I don't see y'all in here. So if you guys see that, the cover, so the cover is actually your nuclear class. The Twitch class is supposed to be after this one. So I'm just going to switch those two covers and put the right class on there. So I'm hoping that you guys go ahead and archive this class. This is your nuclear medicine chat. Okay, this is your chat 19 of nuclear medicine. This is not the chat for the Twitch. So I know I'm missing a lot of you think this is chat for the Twitch. Okay, I'm going to fix it. But again, here is a PET. I want you to make sure you get this down. This is going to be on your CPC. They're going to ask you, what is PET? Okay, what is PET? And then they're going to ask you, what is PET-CT? Okay, so make sure you get that down. And that's most important because a lot of these words that's in here, they're going to ask you, single photon emission computed tomography, SPECT. I can't repeat it enough. Exam. They're going to say, what is it? The technique involved an intravenous injection of radioactive tracer. So this is your CPC question. What involves a technique that involves intravenous injection of radioactive tracer? So remember what I said. When you take your CPC, the answer is in the question. When you get them open and close questions, it's going to be half and half. They're going to be minimal. Take them, be less than 2 minutes, so you can have more time to take your long cases. Do them quickly so you can have more time, okay? Okay, so whole body sagittal PET, the PET, that's what we're concerned about, okay? I'm on page 807. Make sure you get it. Are we late? No, we still got time. So I'm going to fix that, so don't worry about that. But this is your class for tonight, y'all. Thyroid scan. In a thyroid scan, an iodine radionuclide, usually iodine. My girlfriend used to get those. She used to get those a lot. Is administered orally, and the scan reveals the size and shape and the position of the thyroid gland. Here. When you guys get your book, this is what I want you to study. This right here. This is very important. You need to know the difference between these two. See how they sound and look alike. Now imagine this on a test and then you get confused with vitro and vivo. So you see how important that is? If you don't study this and you see this, you're going to get tripped up on, you're not going to sure which one it is, okay? We just went over that, but I still want you to do it. Radioactive iodine uptake, RAIU, go ahead and get that. Okay, so I'm on page 808. The class is over, but you guys are going to read this section here, and everything down here in this vocabulary. These are the words we just went over. Okay, some of them a little extra. They put gamma camera in there, gamma rays, high energy ray emitted by radioactive substances. Yes, go ahead and get that down and fix that. Vitro, you guys went over that already. Computed tomography. This is your definitions that you're going to get down. That's your index card stuff. Okay, these are your combinations that you're going to do. Okay, what I'm going to do, I'm going to check down here and see if there's a case down here for you guys to kind of mess around with. Because after that, they just have like stories of patients. They have stories of patients. Basically, we've already finished with the chapter, but well, is this a case study? This looks like one. You guys can mess around with this. This is a case. This is a coding case right here. So you see something that says case study. It's actually a coding case. They're telling you about a case study. That's a report that they provided date. You can mess around with that if you want to. Try to code that. Send it to me. Let me see what you come up with. Okay, that's a case study. Go on Elsevier or to get your book, or go to that Kindle and get those free books. Okay, so I can show you. I'm going to show you this because this is your exercise. After this class, you should be working on this. Sapphire, you have exercises inside the Sapphire portal to do. Your exercise is a little bit different, but it's almost the same. Okay, check your answer. Hospital, general hospital, nuclear medicine. Okay, check the. You see a lot of this in your Hicks-Picks book. We get ready to go over that, y'all. Okay, complete the medical terms. Yes, that's your homework. You're going to do that because we're finished with the theory. Myelography, angiography. Some of this was in your other chapter, right? Barium enema, we talked about that. Okay, your ebooks will have a drop down. Okay, if you are in the Sapphire portal, if you have joined the Sapphire program, you already have this book. So do not forget, in the Sapphire portal, you get this book. Okay, you get the language of medicine book. So you guys go on my website and go ahead and join that portal. Okay, I'm already an hour in. I'm gonna cut this down. I'm gonna flip that cover because this is your class. The other one I'm supposed to do at 8 o'clock. It's just letting you know about Twitch. I more than likely will change that to tomorrow before church. When I get out of church, I'll come back in. Okay. Thank you guys. I'll see you guys again. I'm about to switch that front. So remember, this is your class. This is your medicine class. Okay, if we need to go over this, I'll go over it again. Bye-bye.